Welcome everyone to the SOPHEA Webinar Series, Living Within Planetary Boundaries. My name is Sabine Baunach and I'm the host and moderator of today. It's great to have you all with us. With the webinar series, just to give you a little bit of background, we strive to develop a vision how transformation towards a healthy and just life within the given ecological boundaries that we have is truly possible. With this vision, we really want to develop a vision that is not only a utopia, but a realistic and really actionable pathway for our future. So far we have learned about underlying concepts. We explored the implications to our health, to key sectors, specifically for Africa. But we have also learned about opportunities from a health and economical perspective and heard about successful initiatives from the East African and other regions, which are worth to be scaled up. The recordings from the last sessions can be found on the SOPHEA websites if you want to go back and visit some of the sessions and are curious to learn more. So you will find them there. But today, I think is a very exciting momentum because we're going to talk about planetary health education. We believe that education can tip our global society and transform it to a better, healthier, and fairer world. That's quite a statement, but I think we can live up to it. Together with our speakers today, we will explore planetary health education at the transformation pathway. And we will hear on the Planetary Health Alliance's roadmap for action, in which education is one of the key pillars. We will hear about integration of planetary health education for health professionals and advancing planetary health education in East Africa. And as a very special highlight of today, we will see the launch of the SOPHEA Planetary Health Toolbox, which is an open access online library for educational material all around planetary health. So I would say that the toolbox is really the centerpiece, the heart of the SOPHEA project. And today, together with the SOPHEA team, we will launch it and get some additional information on it, how it works, and so on. So we'll hear more about it later. But for now, I'm very happy to welcome our panelists. With me, and I'm sure you know her all, is Marie Studer. We also have Magãelhas, and I hope I pronounced your name right, Daniele. We also have Eva-Maria Schwienhorst-Stich and Melvine Otieno, who I haven't seen online, but I hope that she will be able to join us just in a few minutes. So welcome, everyone. It's really great to have you with us. Before we start with the first presentation, just a few ground rules. We will hear 4 presentations, followed by a panel discussion at the end. There will be a 5-minute break after the 3rd presentation. And during the presentations, all participants are welcome to type any question, comment, or if you want to share a thought or resource, you can just type it in the Q&A window, and our speakers can either reply directly or we can pull some of the discussion or questions up during the panel discussion at the very end. So now, without further ado, I have the pleasure to introduce you to Marie Studer. She is our first speaker today. Marie is an executive leader with more than 20 years of scientific and education program and operational experience. She's especially interested in creating awareness and action using the planetary framework to address the United Nations Sustainable Development Goals and also other international targets for transformational change to enable a regenerative society where all life can thrive for generations to come. A really nice vision. Just a bit on your background as well. Marie is Executive Director of the Planetary Health Alliance. She holds a PhD from the University of Massachusetts, Boston in environmental science and a BA from Wheaton College in chemistry. Marie, it's really an honor to have you with us. Very exciting. Please share your slides and the floor is yours.
Wonderful. Thank you so much. I'm delighted to be here. So I'm going to share my slides and please just confirm that you can see them and that they're, whoops, in the presentation mode. Or yes, great. Well, again, it is my great honor to be here today and to share with you the Planetary Health Education Framework, Roadmap, and Action Plan. There's a lot going on in this space, and it's very exciting and really wonderful to be able to work with people like you who are out there interested in this topic. Just to ground us all and to remind us about planetary health. So planetary health is a concept that was launched really in 2015 with the Rockefeller Lancet Commission report, which is a great piece of background material if you need to learn more about planetary health. But it's a very solutions-oriented and transdisciplinary scientific field, and it's also a social movement. And it really looks at how human disruption of our natural systems impacts all dimensions of human health and well-being. But it is also very much a solutions-oriented and applied, pardon me, field that looks at how do we advance our knowledge, our technology, and our social systems to create a safe and just future for all. It's a discipline as well and a field that's been, I would say, born in urgency and has a lot of hope. So that's another reason to get working on planetary health right away. Planetary health is a holistic framework, and that looks at all of our planetary emergencies. It includes all dimensions of biophysical change. So we know a lot about climate and health work, but that's just one driver of the changes in our environment. We also have air, water, and soil pollution or biodiversity loss. All of these kinds of biophysical changes interact in complex ways to influence each other, but also influence our health and well-being and that of other life on Earth. And so our scale of our ecological footprint as human beings and the way we lived is at such a large scale that we have, it's estimated that by the middle of this century, environmental change will drive a significant fraction of the global burden of disease. And so we really have to pay attention to these ecological determinants of health. This is another framework or way to look at planetary health. And you can see here in the center, this is what we just looked at. This is our biophysical space, our Earth system, and that's what's changing. And it's changing under pressure of our societal values, how we consume things, how population changes, and through various kinds of technologies. And all of those biophysical changes that are caused impact things like air quality, food production, migration and displacement, access to fresh water, and so on. And the way we set up our societies also then either exacerbates or lessens and makes less the changing patterns of infectious disease, non-communicable disease, nutrition, mental health, and reproductive health. So that's just another way of looking at this, what I like to call planetary health as an umbrella concept for all kinds of environmental drivers. Because of this urgency of the moment we're in, and we really have, maybe some people say, a decade or so to really take on this challenge of something that we call a great transition or changing the way we live. How do we optimize our ecological footprint? How do we shrink it so that we can live within those planetary boundaries that were mentioned earlier and create safe and just societal systems? Well, it's going to take different ways for us to construct and live in our cities, different ways to produce our food, how we manage our natural landscapes and systems for not only ourselves, but the other 8 million species on the planet. And how do we also change our stories about ourselves and how we relate to each other and to the natural world? Well, we think that education is absolutely central to this great transition. And that's why getting education, planetary health education, is so important. And so the good news is there's been a lot of work already done on thinking about some foundational documents so that we have a bit of a roadmap. We have a place to start. And these foundational documents have been developed by the global community. So the Planetary Health Alliance has an education program, and we really started to bring people together. So the PHA is sort of a convener, if you will. It brings people together to work on important topics such as education. So we did so for the Sao Paulo Declaration, which I'll tell you about, as well as the Planetary Health Education Framework, and now the Roadmap and Action Plan. So in 2021, we convened more than 300 people from around the world to work on something called the Sao Paulo Declaration, which looked at 19 sectors of society and provided a very short guideline on what those sectors should do. One of the sectors was for universities and higher education, and it really laid out high-level goals and direction for these institutions, such as prioritizing allocation of resources for transdisciplinary work. So how do you work across disciplines, arts and humanities, science, engineering, and so on, to come together to find these solutions? How do you align faculty promotion and research incentives to better allow faculty to do this kind of work? And also then try to ensure that planetary health curricula are embedded in all programs and faculties in order for people to have this awareness about this urgent need around planetary health. And of course, promote access, and equity across the institutions. From that, and at approximately the same time in 2021, we also launched the Planetary Health Education Framework. And the framework aims to create common foundational language and concepts as the cornerstones for educational strategies. So it's not prescriptive, because as we do planetary health education across the globe, countries are different, cultures are different, needs are different, but we wanted to make sure we had at least concepts that were very clear and that could be embedded in any curricula, in any place, in any space. So that's what the education framework is all about. And it's a really terrific resource, not only just for educational institutions, but I'll say also for people like businesses, or if you're doing executive certificates or otherwise. It's a really nice foundation to look at. Most recently, in April of 2024, just a month or two ago, we launched with our colleagues at the Sunway Center for Planetary Health in Malaysia. They led the Kuala Lumpur Call to Action on Planetary Health and the development of the Planetary Health Roadmap and Action Plan. I'm showing you both of these, because they're very useful, but also they're really important citations. So if you need to go to your university or your school and make sure that people know this is a current need and a current global movement, then you have these resources such as the call to action that says we must act now. We don't have a lot of time. We really need to think about this transition. So that's what the call to action is really useful for. And then the action plan and roadmap gives us much more specific details. So it has we took over a year and more than 100 people globally on 4 different working groups to create this action plan. One of the working groups was education, and I bet many of you that are on this call today may have participated in this effort. And so we had 21 members from 5 regions and 13 countries, and there was a great diversity in expertise, lived experience, and geography coming to make these recommendations in the roadmap. As I mentioned, when we launched the roadmap, we also now currently have 6 action groups or working groups, and these are just getting going, so you have time to sign up and join them. And this work for the action committees are going to be worked on from now until the next Planetary Health Annual Meeting in October of 2025. So over the next year, we're really going to push forward with global commitments and global work to ensure that we have movement in these 6 areas. You can see educating to achieve the great transition is central, right? And it's about building on the work that's come before, not losing that work, but moving forward and trying to see how do we actually implement curriculum across K-12, across higher education, but also into businesses, into multilateral situations. How do we educate everyone and ourselves about planetary health? This roadmap really has 4 major high-level steps, and you can certainly, I urge anybody to please go and look at the roadmap. There's an executive summary, but there's also all the details. But this roadmap for the education highlighted 4 big concepts. One is universal engagement. We have to be inclusive. We have to be value-centered, right? It's about how do we create a safe and just future? How do we have intergenerational equity and interspecies equity? So we really have to think about what we want this curriculum to look like and how we make it accessible to everyone. We also want to highlight community empowerment. How do we strengthen community representation in all of planetary health education? How do we elevate the knowledge of Indigenous peoples and youth? How do we empower women and girls through gender equity and education? So that's another important piece. This other what I should say goal here is to bring along not only educators, but accreditors and decision maker engagement. We know that we can't just necessarily change a curriculum. We have to get it accredited through certain systems. We have to have our accreditation boards of schools of medicine or just our academic institutions agree to have this in the curriculum and to have it be on the exams or whatever. So we have to bring them along as well. It's not just the educators and the students, but the accreditors, and then also decision makers such as policymakers and otherwise, who also can have sort of a top-down influence to make changes. So we need bottom up and top down. And then global transformation through education. And that's really just that's our aspirational piece in terms of reaching the great transition through making changes and people understanding what changes we need to make and help us to find those solutions and changes. I'm going to now shift so you can see where you can find all of this material. It's on the Planetary Health Alliance website. We have an education section, and in that education section, we have all kinds of resources. So not just the ones that I showed you in terms of the Sao Paulo Declaration and the roadmap and so on, but we definitely have a lot of material for educators, for learners. And I do also want to point out, especially today, we have a case study center, which you can see on the right. And when we look at our resources, just to give you a glimpse of what's in there, we have an inventory of planetary health programs and courses from around the world. If you have courses or materials or syllabi or whatever that isn't represented here, please contact me and we'll make sure we get it up there. We have a directory of syllabi so people can have a look, say, what does a planetary health course look like? So that's available. Our case studies that I mentioned. We do have some educational materials for teens and for kids, so those who are teaching younger students. We have our guides and our framework, and there's a planetary health textbook, which is now available in a number of languages, Italian and French, Japanese. It's being also translated into Korean, and so it's available there. But I'm really going to point you to the case study group, because when we look in there, you can see just down here at the bottom, we are highlighting the SOPHEA Planetary Health Education Toolbox, and we want to give a round of applause for that. I'm not going to steal their thunder, but if you click on that, you'll get through to the toolbox. And so that's just another way to get to the important work that's being done with the SOPHEA project. I'm going to leave you here with just mentioning that you can, this is how you get to the Planetary Health Alliance, and then you can navigate to the education materials. But if you're interested in the work that is being done and you'd like to join this community of practice, it's free to join and have your organization join. We have more than 450 organizations in more than 70 countries. We have a monthly newsletter, we have a next gen program, and so on. But for today, I'm going to just stop there and just congratulate our SOPHEA team, not only on this webinar, but also the work that they're doing in the toolbox.
Thanks so much, Marie. Great to see the SOPHEA project mentioned at the Planetary Health Alliance side. And as you probably know, in the toolbox, we have a lot of the resources that you are sharing as well, like the case studies or the entire methodology of the toolbox has been built on the Planetary Health educational framework. So I feel like there are lots and lots of interlinkages and
Hello. So,
it seems like we've lost Sabine. This is the famous internet connection in Berlin. It's always the worst in all of Germany.
I think we have a common goal.
Oh, you're back. We lost you for a minute or so,
Oh,
Sabine,
okay.
but
Oh,
that's
sorry.
fine. I'll go back in the background. You take over again.
Okay. So I was just saying that there are so many interlinkages. So it's been fantastic to use some of the Planetary Health Alliance's resources for SOPHEA and vice versa. So thanks for that. Thanks, Marie. Without further ado, and we can pull up some of the questions that have been in the Q&A already, maybe later on, or you can reply directly. We will move over to Daniele, our second speaker. Daniele Magãelhas is a senior project coordinator at the Global Consortium on Climate and Health Education at Columbia University. She's a biologist with an MPH in environmental toxicology and occupational health. She holds a PhD in environmental chemistry and a specialization in global health and health diplomacy. Interesting background. It's really good to have you with us, Daniele. Please share your slides and over to you.
Thank you so much. Can you see my screen?
This is perfect. Yeah, thanks.
Okay, thank you so much for the invitation. I think we have so many things in common and synergies that we can share and add and make it better to people who have access to all these materials. And I will be happy to share what the Global Consortium on Climate and Health Education at Columbia University have been doing and how we are trying to advance inclusive climate change education for health professionals. So we know that climate change is a health crisis already recognized by WHO, and this is not something that's going to happen in the future, or it's happening in a place very far from us. You can see these two pictures here, the famous polar bear, and now we have different figures for illustrate this crisis, like this horse in a house, rooftop roof in Rio Grande do Sul, Brazil, in a couple of months ago. So we are already living this crisis and with many impacts on health, and we need adaptation efforts as soon as possible. But what we have been doing is not sufficient to make people safe. And part of that is because we don't have sufficient health professionals equipped with the necessary knowledge and skills to tackle this crisis. So we need urgent efforts to ensure climate health hazards don't exceed the capacity of our health supportive system to protect us. The IPCC report brought that the severity of climate-related health risk is highly dependent on how well health system can protect people. And with effective adaptation, we can reduce and avoid many risks for human health. And this has a very high confidence. So we need to improve the capacity of health professionals to be able to advance in this adaptation and also mitigation efforts. And A proof of that is that on 2021, WHO did a research among their state members, and they found out that 55% of the countries flagged the insufficient human resource capacity as a main barrier to implement national health adaptation and mitigation climate plans. And also 46% flagged that they have insufficient access to tools, methods, and technologies. And yet, in 2024, we just have this resolution that was approved in the WHA in May, that the member states asked the Director General to support the states on capacity building of health professionals and provide training to health professionals on the interdependency between climate change and health. And this is our mission at the Global Consortium of Climate and Health Education, the GCCHE. We want to ensure that all health professionals through the world have the knowledge and skills to identify, prevent, reduce, and respond to the health impacts of climate change. And so reducing the health disparities and improving quality of health and well-being. And in our journey, we identify like many actors that are necessary to be part of this education. The first one is the government. They need to have the perfect knowledge to make policies and also to advance in plans, in climate plans and support plans. And health professionals, like public health professionals, are also going to support on the development of these plans, and other health professionals will support on implement the plans. But how can we make this sustainable? We can't train health professionals forever. We need to make this a reality on their background. So we need to train students, future health professionals, with this capacity, with this knowledge, and that's what Marie was talking about, and that we need also to have faculties and researchers with the capability to provide this type of education. And this is a challenge, and we can see that we can't tackle one or another. We need to go through all these spaces, and that's what we are trying to do. And we also have the other actors like the civil society, NGOs, that are very important to advocate between all these stakeholders that I am presenting here. And thinking about that, the GCCHE developed the core competencies for all health professionals. These core competencies can be used to develop curriculum and also to develop toolkit. This core competency is dividing in 5 domains: climate and health knowledge, analytics skills, climate change and public health practice, climate change and clinical practice, policy aspects of climate change and health, and climate and health communication. So we can pretty much tackle all that stakeholders that I mentioned before. And to evaluate how this education have been integrated into public health schools curriculum, we started an annual survey among public health institutions, asking them if they already have climate change in their curriculum. And also we ask how this education have been offered. So we have about 17 questions that we discuss all the aspects related to this education. So in the last year, we invited 1,251 public health academic institutions, and the survey was intended for faculty, academics, and course coordinators familiar with climate and also planetary health. And it was distributed in English, Spanish, and Portuguese. And here in this graphic, you can see the results. So from this more than 1,000 schools, we received the response of 279 schools. And from that, 196 are offering climate and health education, and 110 are offering as mandatory in their curriculum. And we can also see that some areas like Africa, Eastern Mediterranean, Southeast Asia was not very well represented. And so we think that it could be some bias related to maybe to the language that the survey was provided, and also because some institutions that are already providing this type of education, they feel more comfortable to respond to the survey. So we did a secondary analysis. We calculate a sample size that gives us 80% of power to each regions, and we randomly select some schools, and we research on Google and on their website to find out if they had any kind of offering in climate change. And we end up with 135 more institutions, and we classify them as likely to offer or not likely to offer climate and health education. And what we found out when we combine the survey results and also these search results, we find out that instead of having 70% of the schools providing climate and health education, we decreased for 56%. And that's still pretty high. But anyway, we can see that it's 70% was not the reality. So we are working on this survey. We did for the first time this year. It's going to integrate the Lancet Countdown indicators on adaptation. And we also found out that the Africa region is the one that has the lower prevalence of institutions providing this type of education. And so GCCHE has many tools to help to advance on this aspect, and all these tools are free of charge, and because we need to have this kind of education to be very inclusive to everyone that wants to have it and that needs to have it. So we have a webinar called Learning Collaborative, where our members can share and learn about strategies, challenges, and successful stories for integrating climate and health education into health professionals' curriculum. We also have a resource bank where people can find information and resources divided by different specialties like medical, nursing, public health, and different type of resources. And this can help faculties to develop their lecturers and also to students. And we also provide training. We have 3 different types of training, 3 levels. We have been providing trainings for 3 years now, and we reach out to 25,000 health professionals globally. And we have level 1 courses that are more foundational in the concept of climate and health, but give participants the skills to identify and communicate climate and health related impacts. We have level 2 courses that's more focused on implementation, application, and decision making. And we have a level 3 courses, that is more related to more intensive training, more mentorship to a small group to develop specific skills and methodology. And one course that we have been doing globally is the Climate and Health Responders course. This is a free course, and we have been doing this in North America, in South America, in the Caribbean, in Europe, in Southeast Asia, and we are now developing one to the Africa region and also to the Western Pacific. We use the division of WHO regions to guide our courses, because we also try to engage with WHO as a partner, so we can bring all their agenda and policies to the course, so people also from the government can participate, and not only, but also health professionals and sometimes students. So we are going to launch in September the Africa Climate and Health Responder course. I would like to invite all of you. It's free. It's going to be every Tuesday and Thursday. It's just 1 hour and a half, and it will be composed by 11 sections. The registration are not open yet. It probably will open in the next weeks. Or maybe in the middle of July, I think so. And this initiative is a partnership between WHO Afro, Africa CDC, Chance Network, the Global Network of Public Health Institutions, Project ECHO, and ASPA, the Association of Schools of Public Health in Africa. And just to conclude my presentation, we need efforts to build a climate competent global health workforce. And for that, we need to integrate climate and health into health professionals training. And we know that this is a challenge and needs many actions to build this capacity and to incorporate this kind of education in the curriculum. And one is the integrating climate and health into educational curriculum, equipping students and faculty with the skills needed for informed decision-making and effective action. We saw in our survey that most of the institutions that are offering this type of education, they are offering in a knowledge-based and also a little bit going to decision-making. And so we need to provide this education not only in the knowledgeable field, but we need to provide skills that people can act, that people can make decisions. So this is another layer. And also for that, we need to engage national and subnational entities to overcome barriers and support policy changes, resource allocation, and continuous professional development. We also need to fostering interdisciplinary collaboration among health institutions, environmental departments, healthcare delivery. Sometimes health professional doesn't have the environmental knowledge, and so they don't know how to provide this type of courses. And so maybe when we integrating with environmental departments, we can make it easier And thank you so much for your attention, and I will leave my email here. Thank you so much.
Thank you so much, Daniele. A really interesting presentation. I also learned something new, that the Global Consortium is also doing this kind of educational work in other regions of the world, like Africa. And I think for our participants, this might be particularly interesting. If you can type some of the links you mentioned, or also where they can find the course. And I've also saw there's a course for community health workers even. So you're really targeting different groups of health professionals. If you can just share some of this information in the Q&A window, I'm sure our participants will appreciate. Thank you so much.
Sure, thank you.
So we are moving over to our third speaker, who is Eva-Maria. I will also introduce you, Eva-Maria. Dr. Eva-Maria Schwienhorst-Stich is a medical doctor with a clinical experience in pediatrics and tropical medicine and infectious disease. She has obtained a diploma in tropical medicine and public health from the Charité University here in Berlin, and also a Master of Science in International Health. And I think just recently a Master in Medical Education. Congratulations again, from the Heidelberg University in Germany. Her current focus is advancing planetary health education and action locally, nationally, and internationally, and the later through the SOPHEA project. It's just one example. Eva-Maria, the floor is yours.
Thanks so much, Sabine. And thank you for facilitating this webinar and helping such a great deal in the SOPHEA project. Let's just solve the technical issues. So can I get some feedback if you can see it okay?
Yeah, perfect.
Perfect. So I should move to my first. Here we go. Yes, so I'm very happy that we are now at this point where we can launch the version 2.0 of our Planetary Health Education online toolbox. Thanks for being interested in it and being here. I would like to structure my short presentation in 3 sections. I'd like to give a bit of a background on planetary health in Africa, tell you a few things about the SOPHEA project, and then introduce the current state of the Planetary Health Education Toolbox to you. I'm building on what you've heard previously from Marie and Daniele, but also in the previous versions of the webinar, and will just give you an introduction that we talk about climate crisis, yes, but planetary health was born as a new term in a way based on a lot of concepts before. So protecting the environment for health, that's not new. So planetary health, you can say, is a bit a child of global or eco-health and earth system sciences. And the planetary boundaries are very important basis for planetary health. You will also know that, unfortunately, we are heading in the wrong direction. So in the past years, evidence has shown us that by now 6 of these boundaries are being crossed. But I think in education, it's important to make very complex things concrete. So I think it helps to talk about the triple planetary crises, meaning climate change, biodiversity loss, and pollution. So we have to tackle, of course, climate crises, but all these are interconnected. And what does this mean for Africa? Unfortunately, and this is the latest IPCC report, Africa has most adverse impacts in all of the areas studied. And we all know that Africa had contributed the least to the climate crisis. And we have to know that there are adverse impacts, especially for the young generation. This is also from the same report, highlighting again, young people will face most of their lives in the era of climate crisis and the triple planetary crises. And we also know, and the evidence is accumulating, this is some recent evidence from Tanzania published in the Lancet Planetary Health, that climate distress is factor in all of the world, but especially also in Africa. And we have to think about mitigation and adaptation, meaning preventing the unmanageable, turning off the tap, and adaptation, managing the unpreventable, mopping the floor. And there is an abundance of solution. And I think in planetary health education, that's important. We have to focus on the solutions. I'm not reading them out to you, but we see many solutions in mitigation and in adaptation with a huge overlap. So we have to think about resilience. How can we improve resilience? And for the context of Africa, I'd like to highlight this publication from Project Drawdown. They looked specifically at climate poverty connections, and they highlighted 5 areas, especially for the African context: improving agriculture, agroforestry, protecting and restoring ecosystems, adopting clean cooking, providing clean energy, fostering equality, with a huge savings also of CO2 emissions. And if you look at the health co-benefits of all of these, there's strong evidence for direct and indirect benefits. So we have to think about solutions, and when we think about planetary health education. Some examples here: clean cooking, solar energy, and climate smart agriculture and agroforestry. This brings me to tell you a little bit about the SOPHEA project, if you don't know about it already. SOPHEA stands for Strengthening One Health and Planetary Health in Eastern Africa. It's a trilateral partnership between the University of Würzburg, University in Germany, University of Eldoret in Kenya, University of Kuha's Catholic University of Health and Allied Sciences in Mwanza, Tanzania. It's funded for 4 years by the German Development Corporation, and our aim is to explore, investigate, teach, and act on the increasing climate and environmental changes and their interactions with health. We have a couple of activities. At the core, as Sabine said already, is the Toolbox. We launched a version 1.0 in November last year. Launch of the version 2.0 right here, right now. You're witnessing it in a way. I'd like to thank at this point many people. Here you see a glimpse of the SOPHEA team. There are many more people in collaborative institutions that we owe a lot of thanks for their contributions. The activities in general are grouped in education, research, collaboration, community outreach, and student exchange. And I just want to give you a bit of an idea, because with the Toolbox, we want to foster a way of education that we also, try out in the field. Here is an image of a workshop at the partner university in Mwanza last year. We have the summer school in Würzburg, where we try to really empower the participants to become agent of change. We try to do that with a mix of educational methodologies inside and outside the classroom. People have to apply with their own project idea. They receive peer feedback. They get skills training. We have arts-based activities. We have a plant-based cooking class, nature connecting exercises, and I give you a few photo impressions. And we'd like to encourage everyone to try to do a lot of teaching outside the classroom. And the lectures that we've that were performed as part of the summer school, they're all recorded, most of them, and accessible through the Toolbox as well. So the Toolbox will build up as we go along, and we try to have a large audience profit from the education. This brings me to the Planetary Health Education Toolbox. What is it? It is what it is, a box with tools for educators, trainers, and learners alike. What does it aim to? It aims to help users acquire knowledge themselves. It aims to empower users to teach or train on planetary health topics, even though they did not feel like experts before. I think this is very important, that there is no planetary health experts. You have to start from somewhere. And wherever you work, live, or teach, you can integrate planetary health experts. It aims to give didactic guidance, how to use the material in a blended learning or flipped classroom approach, and it aims to empower students to lobby for integration of planetary health into their curricula by approaching the professors and saying, we want this in our curricula, and here is a place where you can get inspired. It aims to empower and inspire people for transformative action and grow the planetary health movement by showcasing examples of good practice from its users to inspire others. What it is not, it's not a MOOC, it's not a standalone online course, and it's not a perfect and finalized product. So as I said, it'll evolve along the way, and it needs the support from the users to give feedback and to submit material. And it's not only for users in East Africa. We have it in our project name. This is our cooperation, but I think it's applicable worldwide. So some impressions when you access the toolbox. This is what it looks like, and I will guide you through it. We have the first section that is didactic skills. I'll tell you a bit more about it in a minute. The second section is good practice examples and case studies. And then we have 20 sections of thematic material with background reading, slide material, videos, and recorded webinars. We also have, and this has not been used yet, but will be used in the future, a new communication forum where you can communicate with all people who are logged in, or not who are logged in, but who have once accessed the toolbox. And we have just a couple of days ago included acknowledgements for contributors. And I repeat the call for submissions, and everyone who submits material, of course, will be named in the acknowledgements. I will give you a bit more impressions about these three areas now. The didactic skills. So I think it's important to understand that, as I said, it's not a standalone course. It is material that you can use to build your own planetary health course by using the flipped classroom approach, which means there are a lot of expert lectures, and you can have students have a look at the lectures and then build on these in discussions in class, for example. Meaning using it in a blended learning approach, combining online and in-person learning, and being able to outsource knowledge acquisition in a way. And we tried to give also some guidance on how a good methodologically sound course can be done. And we've done this on two levels. One is we've provided a blueprint for didactic skills training, meaning if you want to approach a university and to include more planetary health education in a curriculum and want to show how the toolbox can be used or how it can be integrated. And the second level is blueprints on how a lesson or a course can be structured. This is what a blueprint looks like, and it helps prepare structure sessions, gives guidance in using mix of teaching and learning methods, aims at better learning outcomes, and tries to promote transformative education. The second section, good practice examples and case studies, we've just recently included this. So by now there are 3, and it calls for much more submissions from the planetary health community. We have asked within the SOPHEA participants, and there will be more, but as of now there are 3, and it needs your submissions of good practice example. The case studies, we've included some of the African Handbook of Climate Change Adaptation. Also, there's a link to the Planetary Health Alliance case studies. And then there are 20 thematic sections. We've increased them from version 1 to 2 by 2 after we got the relevant feedback. And this is the current state. And all these sections are grouped in background documents, slides, and videos. And background documents are either web links to websites or articles, or they are PDFs that can be downloaded. The slides, you find at least one in every section, sometimes more, but this will grow as we go by contributions from the SOPHEA project, but also from the users. And what is important to note is that slides are not complete slide sets for an entire topic, but they serve as material to integrate into your own teaching, and they can be used under a Creative Commons license. And of course, we acknowledge all contributors of slides. More to come, as I said, and please contact us if you would like to see your slide contributions in the toolbox. Last point, videos. What we've done is we recorded all the webinars. We recorded many of the contributions at the summer school, but also included lectures from other collaborators or videos that can be then used, as I said, in a flipped classroom approach. Have the student watch the video and then refer to them in a classroom discussion. How to access the toolbox? It's been a bit tricky in the past because unfortunately the interface is in German. The reason is that we can use it for free, of course, it's from my university, but now we've provided, I hope, a very clear step-by-step guide that everyone can access the toolbox with a few clicks. And so my conclusion is, please use it, spread it, and contribute to it. And my conclusion is, with beautiful views of Lake Victoria, climate and ecological crises are the biggest threat to health. To protect and restore planetary health is the responsibility of all, not only health professionals. Abundance of solutions and health co-benefits is there, and the toolbox can be of help to advance planetary health education. And I'd like to mention that we are not in competition with the two presenters earlier, but I think it became clear that we work together. This is why we invited you today. And I think we're all complementing each other, and I'm very happy to work together in the future. With the words of my colleagues from East Africa, Asante sana kwa kunizikiriza.
Thanks, Eva-Maria. I think it's obvious that it's really a super rich toolbox. And I'm really encouraging everyone to check it out and have a look. As you said, it's a work in progress. So this continues to grow and also become richer and even more important at the community that is behind the SOPHEA project, and part of the SOPHEA project will continue. So yeah, thanks for that. We now have with us Melvine Otieno. Hi, Melvine.
Hi.
I'm glad you made it in time. I just would like to introduce you briefly. Melvine Otieno is an environmental health scientist. She's one of the founders of the Planetary Health Eastern African Hub and also the SOPHEA project coordinator for Kenya. Melvine obtained a Bachelor of Science in Environmental Biology and Health and a Master of Science in Environmental Health at the University of Eldoret. And she's currently pursuing her PhD in Global Health at the Martin Luther University in Halle-Wittenberg here in Germany. And I always find that interesting to know she also served as a Next Generation Fellow of the Planetary Health Alliance. So I always find it interesting that we always encounter those fellows from the Planetary Health Alliance at so many different locations all around the world. So it's great. And it's interesting to follow your careers. So it's really good to have you. I'm glad you made it in time. Please share your slides and then the floor is yours.
Thank you so much, Sabine, for that wonderful introduction. I'll just share my screen in a short while. I hope you're able to see it now.
Perfect, yeah.
Yeah, thank you so much. Based on what my previous speakers have presented, I would like just to share the perspective of implementation of the planetary health education in Eastern African universities. And this is also based in the journey that we've done through the Eastern Africa Hub, the Planetary Health Eastern Africa Hub, which stimulates regional community building, also provide education for transformative action, and push for strategic policy making in the face of the greatest planetary health emergency over time. So you find out that this initiative is one of the global planetary health alliance regional hubs. And our initiative really started when it was initiated back in 2019 and officially launched in 2020 with the support of the German Alliance Climate Change and Health, that is KLUG, and also the Women Leaders for Planetary Health, where we were able to develop a multi-sectoral capacity building program. And the mission was to advance, advocate, and also create awareness in the field of planetary health and One Health in the region through education, empowerment, and research. And as we all know, based on my previous speaker statement, we see there is a shift of acquired knowledge to transformative action. So in order to enhance for the long-lasting solutions, we need to engage a number of diverse groups from educators, students, and also policymakers, and also researchers, and also journalists and all. So through this organization, or let's say the regional hub, we really learned a lot from the German experts, especially through the Planetary Health Academy under the KLUG, whereby they initiated a planetary health lecture series back then. And it was so interesting for the Eastern Africa community to also learn from them. So at our initial stages, we developed our goals under the education sector. How can we really move forward? Because there's a lot of gap in knowledge and also implementation aspects in the region. So basically, we were able to provide courses by developing and also disseminating planetary health courses through a diverse network of universities that we have. And also, we were able to also provide online planetary health resources. By this, we're collecting and also putting together resource materials in our website. And also in the process, we were able to create a network of experts and key opinion leaders. So by this, we used to develop a webinar series where we bring together professors and also researchers to share the works that they're doing. And also, we work closely with through the Planetary Health Alliance Next Generation Network, that is the Campus Ambassador Program. We've been trying as much as possible also to engage the students in empowering them to champion planetary health at university level. And they have really done a number of activities in line through case studies together with the local communities and others with the policymakers. And this has also been an opportunity for them to even come up or initiate clubs into their university. So we have a number of already formed clubs across the globe and also in the Eastern Africa region based on the number of increment of the campus ambassadors that were able to be selected by the PHM. And aside from that, also our goal has been to have international knowledge sharing. So anytime we have this webinar series, we always invite other researchers from across the globe to share the works that they're doing together with the Eastern Africa communities through projects on different thematic planetary health sector. And our first activities back then we started off with the lecture series and workshops. And that time we had already launched the hub and we were like, how can we bring our communities together? So education was the best strategy. But this time around, we initiated and brought a number of community members who contributed or participated in our online lecture series. By then, we introduced what planetary health is. And we were also honored to have Dr. Sam Meyers with us, the Director of Planetary Health Alliance, who introduced planetary health concept to our community. And also we were able to share more about the challenges and opportunities on the way to planetary health, and also how does transformative paths really work. And we were also honored to have Dr. Martin Herman, the Director of KLUG, who has really been a supporter in our initiative. And through that, he was able also to contribute in this lecture series. And also, of course, with our colleagues who are also part of the SOPHEA team and also members of the Eastern Africa Hub, like Given Monga has really played a crucial role because he's our policy advisor, as in our planetary health education advisor for the Eastern Africa Hub. So we've really worked along with all of them, and also worked closely with the Dr. Nicole De Paula, who is the founder of also Women Leaders for Planetary Health, to contribute into this lecture series and all. And also we've been inviting researchers from different research institutions in East Africa who also contributed immensely during this lecture series at the very beginning. So the next steps, we saw that now that many individuals had interest in education, we were able to strategize, because a number of our participants back then were the people from the academic angle. So people from universities, a lot of them attended. So we ended up having another small project where the team of the Eastern Africa Hub really came with a consultative meeting where we invited stakeholders from different universities. These are just some of the few universities of members that joined. And the aim of this consultation was to encourage planetary health education initiatives and also build a regional network of these planetary health education experts. And also we were able to establish relevant concepts and key topics of planetary health. And also it was also a good opportunity to share the exchange best practice examples between these different institutions. In the end, we narrowed down to these universities to enable themselves to discuss like what are some of the thematic areas they really needed to focus on. And these were just some of the few summarized thematic areas they wanted to really push forward or maybe review in their educational curriculum. Like for instance, the University of Eldoret was able to also review their curriculum, and now they offer planetary health as a unit for postgraduate students and also as an elective course for the undergraduate or any other interested student from diverse disciplines. So these are just some of the examples of the 3 universities we were, as in the university we piloted, and also we also needed not only to focus with the public health sector, but also the medical institutions as well, so that they can also review their curriculum. So a good example is also from the Zambian team. Through the University of Zambia, we were able to develop a climate change and health and planetary health elective course. And these are some of the objectives. They were able to introduce planetary health concepts and the health of the impacts of climate change. And also they were able to explore the emerging infectious diseases and were able to describe between what really is the difference between or the linkage between climate change and planetary health. And they're able also to identify and elaborate the main climate sensitive diseases, particularly that relates to global south, and also explore the areas of action, mitigation, and adaptation and advocacy. So, and also this is just an example of how the courses for the University of Eldoret elective course looked like. They were able to organize one for biodiversity and planetary health lecture, another one for nutrition and planetary health. And in this, we are, as I said earlier, we always incorporate collaboration amongst the networks within the planetary health space. So we've also worked closely with Dr. Jane Fakol in a number of projects. Like back in 2020, we did a project on child health and nutrition, and she was able to contribute. And also we were able to have contribution from our own lecturers within our university, and also given her to share like his perspective on malnutrition and health from the Zambian aspect. So basically within our space or within this network, we are trying to bring together all the networks that we have and with the common, like based on the experiences that they have. If the thematic area is nutrition, we look at who is doing what on nutrition, how can they share whatever they're working on so that they can leverage their networks and also collaborate further in their projects. So also there are just some of the other interesting universities that have also been able to integrate planetary health. We have like Egerton University. These are just a few. And we also have the Zambia University and also Catholic University, who is part of the SOPHEA, and also universities in Ethiopia like Jima are also now interested in planetary health education, and they want to develop a way that they can also focus on it. Now that we have the SOPHEA Toolbox launch, it's gonna make work easier for them to really review the educational curriculum and use the learning resources that we have through our SOPHEA Toolbox. So without leaving behind the people from the medical practitioners, we know that very well education for sustainable healthcare is really key. And without forgetting that planetary health, indigenous perspective are the core knowledge, values, and practices need to be incorporated into the education for this sustainable healthcare. So by this, the Global South and of course, East Africa and Africa as a whole can lead the way on incorporating this new approach to the medical education. So by this, back then we also did a pilot, and we collaborated with Daktari Online, and we initiated the medical planetary health curriculum. By working with this Daktari Online, there are organizations in Kenya who bring together medical practitioners across the country. So they were able to introduce planetary health in the region, where they had 3 sections of discussion. They introduced planetary health, shared about health impacts and climate adaptation, and also climate change and health in clinical practice. And we were honored back then to have Jeremy Pivo, who was a team member of the Planetary Health Alliance, who contributed in this initiative, and also our amazing Dr. Nosiku Munyinda from University of Zambia also contributed in this webinar series. And also we've had Dr. Omnia Elomrani, who is one of the amazing climate change champions in Africa. She also was able to contribute in this. And also Dr. Christopher, who also contributed, and also basically Dr. Courtney Howard, who also contributed based on the experience she has on the climate change and health in clinical practice. So basically we were able to reach a number of around 1,791 who were able to register in this webinar series. And,
Melvine, sorry if I'm interrupting. If you can just maybe modify your microphone a little bit. We cannot hear you so well anymore.
Okay, what about now?
No.
Sorry, let me just start it again. Can you hear me now?
It's very quiet on my end. It seems that your microphone is a little bit detached, maybe.
Let me try again. And what about now?
Now it's better. Thank you.
Sorry, just to continue, I would like to say that during this Daktari Online webinar series, we were able to reach out a number of medical practitioners, from clinical officers to medical officers, and also people from the pharmaceutical technologists, and also nurses, interns and students, and also lab technicians and other participants who are able to join, as you can see from the percentage. So this really brought back conversation on how they can integrate planetary health and climate change into the medical practitioner or medical background. So, because we all know that medical education really exists to ensure the health of the community. So as you can see from this graph, you can see that majority were from there were technologists who participated in a number, and we also had medical officers, nurses, and they really enjoyed this webinar series, and they even got a certificate out of it. So based on that, we also ended up strengthening our networks with the Kenya Medical Association, whereby they have even formed, they have done a conference before on planetary health and climate change. And in the process, within their team, they decided to come up with a team where they really need to integrate planetary health into the medical education. And strategically, they needed also to bring together the universities that are teaching the nursing career and all, so that they can really review their educational curriculum and integrate planetary health and climate change. So the future of the medical engagement at Planetary Health Eastern Africa Hub community is really vital, because we need to engage more medical students to increase our awareness among them. And also we need to create the largest network of partners in healthcare working on planetary health also in Africa. And also to systemize efforts on planetary health education and steer integration into the curriculum. So aside from that, within the Eastern Africa Hub, we've also before presented the works we've done through the Planetary Health Annual Meeting, which happens every year. And this one was just an example of what happened back in 2020. We had experts from diverse backgrounds who shared their project ideas, and also the work that they do within the Eastern Africa region, and the work that they collaborate on. And for sustainability purpose now, after we saw that there was really need for education and moving from knowledge to action, we ended up having an idea of the SOPHEA project through one of the climate change and transformational course that is always held by Klug. And that was a good opportunity for us to network, and that's how I met Eva-Maria, and now we ended up like initiating this project that she had already elaborated earlier on SOPHEA. So this is just a good example. Like at the moment, the Eastern Africa Hub members are given, and I are co-facilitators of this climate change and health course that is for the University of Munich. And this was just the beginning when Klug started this initiative of offering this transformational and climate change education among its different participants, not only from Germany, but also from the people from the Global South. And we've really, really benefited and learned a lot from them. And that's why we saw that there was need for us to develop this toolbox that will be sustainable so that most universities will be able to integrate or review their curriculum and integrate planetary health into their curriculum. So what are some of the next steps for the institutions in the Eastern Africa? We see that the next step is to institutionalize climate change and planetary health education at universities. By this, through the SOPHEA Toolbox, we'll be able to disseminate. And now that we already have launched 1.1 and as in 1.0 and also now 2.0, we see that now we are in a good state of disseminating planetary health to several universities who are really interested. And also this will further and deepen collaboration between different faculties and universities in the sector of education and research. And also we need to explore ways of engaging local communities. And strategically, there's need for leverage and facilitating this network of researchers, especially the early career researchers at those who are doing their masters and also PhD, so that they can share they can do projects that align with the planetary health and One Health concepts. So we also need to bring on board more universities, not only from our region, but beyond. And also we need to participate more in regional and international conferences. There's a number of conferences already happening in Africa as far as climate change and health is concerned through our networks like Chance Network. They're already having a call for abstract submission for their upcoming event. And we also have another one from the Lagos University. Young professionals are coming up with the climate change and health where they bring the youth together, and that is happening also in August. So we need also to share learning resources and also good best practices, like we had mentioned earlier through where Eva-Maria mentioned within the SOPHEA, we also have the case studies and good best practices. So we call upon all of you who are interested to share their case studies so that we can learn from each other. And also through the didactic skills, we need to train a lot of educators so that we can improve on how we integrate or we relay information on planetary health and climate change. So with further ado, I would like to just say the next step for the Eastern Africa Hub and also the SOPHEA as a whole, we need to organize more consultative meetings and workshops on education and research, and also share these materials, and also especially through the support of the Planetary Health Toolbox, and also aim to disseminate these resources further to more university. Thank you so much for listening, and I'm looking forward to engaging further and maybe questions from the audience. Over to